to the North Carolina Medical Society Spotlight. I'm your host, Sue Ann Forrest. Today, we have a special guest with us here at the North Carolina Medical Society headquarters, Dr. Richard Bunio. Dr. Bunio works at the Cherokee Indian Hospital, and we're looking forward to learning more about his service to this patient population. Dr. Bunio, thank you so much for joining us today.
Thank you for having me.
Well, we're excited to learn a little bit more about you and what you do in Cherokee County. So tell us a little bit about how you ended up there.
Well, my journey was quite extensive. I actually started my career up in Canada. And I went and did some volunteer work where I met my wife, who's a member of the Eastern Band of Cherokee Indians tribe. And she said, why don't we just live in North Carolina? And I said, yeah, that seems a little warmer. And I've loved it ever since. I've been there about 20 years now.
So how is your patient population a little bit different?
We serve the enrolled members and descendants of the Eastern Band of Cherokee Indians, so our population is pretty defined. It's about 12 to 13,000 members that we serve.
So what do you love most about working with that particular population?
Working in Cherokee was very easy for me. You know, coming from Canada, which was, of course, a universal healthcare system. I came to Cherokee where everybody's health care is covered. You know, as part of the Indian Health Service, they have prepaid health care, which means I don't have to worry about anybody having enough money for medications or, you know, any sort of medical care that they would need. So it's very easy for a provider, good for my soul, if you will. Yeah.
So what do you enjoy most about being there? Like what kind of gets you up in the morning to serve?
I think the people I work with and the community is very supportive and very welcoming. The culture is extremely interesting and really helps you to focus on you know, things more than just sort of the day-to-day work that you have to do. We have some guiding principles, and one of them, given to us by the tribe, and one of them is a state of peace and balance. And you don't often hear that nowadays. You know, you hear about work-life balance and how some people struggle with that. But here we're in a health system and a community that understands that balance is important in everything we do.
So you have an interest in population health. Can you tell me a little bit more about that?
Yes. So working in Cherokee, one of the other guiding principles that we have is the hospital belongs to the community. So we are, if you will, servants of the community, and population health is extremely important to us. I know a lot of health systems are looking at population health now, and I think that's really important. We are part of a health system where we partner with the public health department to try to wrap our heads around things like social determinants of health and adverse childhood experiences. And we're doing that because we feel like as a medical system, we've kind of pushed all the buttons and pulled all the levers we know how to pull, and we're kind of stuck. And until we really understand, you know, what's happening in the community, we don't think that we're going to be able to make the impact that we want to.
So you just touched on rural health care too. Why do you think that's important? And do you think patients and physicians and the state should be focusing more on rural health care?
Obviously, there are needs, both urban and rural. I think there are some challenges in the rural areas that are unique in terms of access to different services. And it's a huge population that often doesn't have a very strong voice. Mm-hmm. So yes, I think it's something that that does need focus, and that hopefully we can be influential there and get some resources out to the rural areas where it's needed. Certainly now with telemedicine and some of the new technologies, we're getting better and better at that. But I hope to see the day when, somebody in Cherokee County can get the same services as someone in Durham.
Well, thank you, Dr. Bunio. It was a pleasure getting to know you and learning more about your experience at Cherokee Indian Hospital.
Thank you.